Hi friends, welcome back to 1000 questions and answers series. The first question is a multi-system disease with a fever, lymphadenopathy, arthralgia, weight loss, malabsorption, chronic diarrhea, celiac disease, lactose intolerance, Whipple's disease, liver cirrhosis. It's known as Whipple's disease. Next question. Painful, deep, sloughing ulcers caused by bacteria which principally affect the gums. Gingivitis, Vincent angina, canker sore, leukoplakia. It's Vincent angina. Next question. Premalignant glandular metaplasia of the lower esophagus in which the normal squamous lining is replaced by columnar epithelium. Diverticular, hiatal hernia, Barrett's esophagus, gastroesophageal reflux disease. It's known as Barrett's esophagus. Next question. A sweet, slightly fecal odor present in hepatic encephalopathy is asterixis, halitosis, fetor hepaticus, and apraxia. It's known as fetor hepaticus. Next question. Form of diabetes resulted from the autoimmune disorder is type 1 diabetes, type 2 diabetes, gestational diabetes, and diabetes associated with other syndromes. It's type 1 diabetes. Next question. Complication of liver cirrhosis resulting in accumulation of ammonia in brain tissue. It's known as portal hypertension, esophageal varices, ascites, hepatic encephalopathy. It's known as hepatic encephalopathy. Next question. Which of the following position can be given after liver biopsy? Supine position, left lateral position, right lateral, prone. It's right lateral position after liver biopsy. Next. Which of the following drug has to be restricted 1 week before urea breath test? Ranitidine, omeprazole, Lasix, both A and B. It's ranitidine and omeprazole. Both are restricted 1 week before urea breath test. Next, which of the following investigation to be done for a patient with elevates serum cholesterol level? LFT, RFT, CBC, and prothrombin time or INR. It's liver function test. Next, pain in the McBurney's point is a sign of appendicitis, peptic ulcer, diverticulitis, peritonitis. It's appendicitis. Next question. Rebound tenderness and abdominal rigidity is seen in patient with colon cancer, peritonitis, pyloric obstruction, hepatitis. It's seen in peritonitis. Next question. Which of the following terms should the nurse use to document the patient's black tarry stool? Melena, hematochezia, hematemesis, steatorrhea. Blood in stool, it's melena. Next question. Major cause of diverticulosis is chronic constipation, peptic ulcer, diarrhea, colon cancer. It's chronic constipation. Next, regional enteritis is otherwise called ulcerative colitis, Crohn's disease, diverticulitis, irritable bowel syndrome. It's Crohn's disease. Next question, the most common area where the Crohn's disease will affect transverse colon, jejunum, ascending colon and terminal ileum. It's ascending colon and terminal ileum. Next question, dryness of mouth is stomatitis, dehydration, xerostomia, canker sore. It's known as xerostomia. Next question, inflammation of tongue is called gingivitis, periodontitis, lymphitis, glossitis. And the answer is glossitis. Next question, dilated submucosal veins that develop in patients with underlying portal hypertension and may result in serious upper gastrointestinal bleeding. It's known as esophageal varices, aneurysm, phlebitis, none of the above. It's known as esophageal varices. Next question, which of the following position can be given for sigmoidoscopy? Left lateral position, knee chest position, prone position, both A and B. It's left lateral or knee chest position. Next, lower gastrointestinal tract can be studied with barium solo, colostomy, ERCP and barium enema. It's studied by barium enema. Which of the following diet can be prescribed for a patient after a contrast-based procedure? High fat, low fat, high protein, high calorie. High fat diet should be followed. Which of the following is most significantly notified after paracentesis? Decreasing abdominal girth, decreased urine output, hematuria, diarrhea. It's hematuria. Next question, which of the following to be done before paracentesis? Keep NPO for 6 hours, administer antiemetics, empty the bladder, administer enema. We should empty the bladder. Immediate assessment of post-liver biopsy procedure shows pulse rate 108 beats per minute. What should be the next intervention? Document it as normal, measure the BP, recheck it after 1 hour, position the patient on left lateral side. We should measure the BP. Occult belt is seen in which of the following disease condition? Anal fistula, hemorrhoid, colorectal cancer, intestinal obstruction. It's seen in colorectal cancer. Next question, which of the following is the most frequent cause of peptic ulcer disease? Helicobacter pylori, Streptococcus, Staphylococcus, Haemophilus influenzae. And the answer is Helicobacter pylori. Next question. The sac-like outpouching of the wall of the colon is intussusception, intestinal obstruction, diverticular, hernia. It's diverticular. Next. Which of the following hepatitis is spread via fecal-oral route? Hepatitis A, B, C, D. Hepatitis A. Next, the condition in which lower esophageal sphincter fails to relax: achalasia, bulimia, gastroesophageal reflux disease, pyloric stenosis. It's achalasia cardia. Next question. Varicose vein in the rectum is termed as fistula, hemorrhoids, malocclusion, none of the above. It's known as hemorrhoid. Next, normal serum bilirubin direct is about 0 to 0.3 mg per deciliter, 0 to 0.03 mg per deciliter, 0.6 to 0.09 mg per deciliter, 0.09 to 1.2 mg per deciliter. It direct bilirubin 0 to 0.3 mg per deciliter. The most sensitive indicator of liver injury: albumin, ALT, globulin, bilirubin. It's alanine aminotransferase, ALT. Next question. Jaundice is clinically evident when the serum bilirubin is level is above 1, 1.5, 0.5, 2. 2 mg per deciliter. Next question. Fluoroscopic examination of upper GI tract to determine structural problems and gastric emptying time with the contrast is angiography, endoscopy, barium solo, gastric analysis. It's known as barium solo. Next question. The procedure in which balloons placed in esophagus inflated to compress the bleeding: varices, balloon tamponade, cryoablation, octreotide. It's balloon tamponade. Next question. Condition where areas of keratosis appear as adherent white patches on the mucous membrane of the oral cavity: stomatitis, leukoplakia, viral infections, mumps. It's known as leukoplakia. Next question. Billroth first procedure involves esophagojejunostomy, gastrectomy, gastrojejunostomy, gastroduodenostomy. It's gastroduodenostomy. Dumping syndrome is a complication of peptic ulcer, gastric surgery, CS stomach, intestinal obstruction. It's a complication of gastric surgery. Next, irreducible hernia which obstruct blood flow to the intestine: femoral, umbilical, strangulated, incisional. And the answer is strangulated hernia. Next question. Method of supplying nutrients through central venous route is gastrotomy feed, total parenteral nutrition, peripheral parenteral nutrition, intestinal tube feeding. It's total parenteral nutrition. Next question. The most common cause of intestinal obstruction is adhesion, hernia, volvulus, neoplasms. And the answer is adhesions. Next question. A patient with duodenal ulcer will experience pain 2 to 3 hours after meal, vomiting, weight loss, hemorrhage. Pain 2 to 3 hours after meals. Next question. Profuse rice water stool suggests dysentery, cholera, typhoid, irritable bowel syndrome. And the answer is rice water stool is seen in cholera. Next question. Painful swallowing is termed as dysphagia, odynophagia, dyspepsia, ataxia. And the answer is odynophagia. Next question. Involuntary flapping movements of the hand seen in metabolic liver dysfunction is ataxia, asterixis, apraxia, tics. It's asterixis. Next question. Surgical drainage of excessive peritoneal fluid is dialysis, intercostal drainage, paracentesis, fluid synthesis. And the answer is paracentesis. Next question. Assessment of finding of a patient with cholelithiasis, protein intolerance, fat intolerance, right upper quadrant pain, hematuria. It's right upper quadrant pain. Next question. Normal portal venous pressure 1 to 5 mm of Hg, 5 to 10 mm of Hg, 10 to 15 mm of Hg, then 15 to 20 mm of Hg. Normal portal venous pressure is 5 to 10 mm of Hg. Ecchymosis on flank is seen in pancreatitis termed as Cullen sign, Great Turner sign, Collins sign, Rovsing sign. And the answer is Great Turner sign. Next question. Laboratory value expected in liver failure is decreased creatinine, decreased sodium, increased ammonia, increased calcium. And the answer is increased ammonia. And thank you to everyone.